Okay, you're live, Selene.
Hi, good morning, and I'm Selene Daly, and I was just on with Pat talking about melanoma and how you can spot skin cancer, basically. And I was talking about a new program that's on the UK. So we had a question on Twitter from somebody asking, I think it was a physiotherapy background, about the course and where you can do it. So it's the Skin, the Karen Clifford organisation, and that's www.skcin.org. If you go onto that website, you'll get all the information on what causes skin cancer and how to spot a skin cancer. And the program itself is called MASCED. That's MASCED, and it stands for Melanoma and Skin Cancer Early Detection. It's an accredited online program, and it's there's actually two parts to it. There's one for healthcare professionals, so that's physiotherapists, OTs, for example, and then there's one that's for beauty therapists and hairdressers. So certainly it is absolutely worth it. You get a certificate after, and the Skin website is fantastic. I've worked with them previously on a Safe Schools programme where we distributed hats in County Sligo, sun hats for the kids in County Sligo, and they really helped us out so much with that. And the information, as in the posters that you can print off for your business, they're really fantastic. So I'd highly recommend going on that. That's www.skcin.org. I think we have a few questions.
We do have a few questions, so I grab that for you. So a couple of questions here have come in for you, Selene. First one is, how much vitamin D do we need?
Okay. This is always a good question. So it's a bit controversial, and I know if I was working with osteoporosis, I'd be plugging vitamin D all over the place, and it's so important for our bones and our neurology function. And the more we're looking into vitamin D, the more we realise how much we need it and how it's an important part of our diet and for our body's well function. So at the moment there's a programme running that children are all supplemented with vitamin D. Anyone living in the Northern Hemisphere has low levels of vitamin D. However, blasting yourself with sun is not going to make more vitamin D. So for example, if I go to Lanzarote for 6 weeks and I get sunburned and I get tanned deeply, it doesn't mean I'm going to have enough vitamin D for the winter. You lose your vitamin D quite quickly in the Northern Hemisphere. If you look at your diet for a start off, so I'm a big fan of, nothing to do with them, but having more super milks. And actually I've seen in Aldi, Lidl and Tesco that they have a version of this milk as well now that's got lots of supplements of vitamin D in it, enough for your day. So if you use that in your cereal and your tea and coffee, you'll find you'll have a good source of vitamin D there. Eggs and oily fish as well, great source of vitamin D. If you're worried about vitamin D, go to your GP and get your levels checked. You can also go into your local health food shop or your pharmacy. I know Care Plus Pharmacy have a great range of vitamins at the moment. You can go in there and buy a very cheap vitamin D supplement you can take once a day. That's a really simple way to top up your vitamin D without burning your skin.
A couple more questions.
Great.
So Maeve wants to know, what is the best treatment for hyperpigmentation?
Okay, so hyperpigmentation is where we have brown or dark brown black marks in our skin. Often this happens, and it's from a lady, from Maeve, often this happens if we're on the oral contraceptive pill or we're pregnant. So it's very important, if you have a history or family history of hyperpigmentation, that you protect your skin with a full factor 50. So what do I recommend? Avane have a great one called Be Perfect at the moment, or Be Protect, excuse me. A big fan of Ovel's Elav Factor 50 plus. It isn't a factor 45 for your face, a 50 for your body, that doesn't contain chemicals or parabens. We've got La Roche-Posay and Thales range is wonderful, and Bioderma have a huge range of sunscreens that are all factor 50. Have a hat for your face, so a hat with a 6-inch brim on it to protect your nose, your cheeks, the top of your forehead from the UV rays, which is going to cause the hyperpigmentation. Also look and see if you're on an oral contraceptive pill. If you can come off it, it might be a good idea for the hyperpigmentation as well. So just keep the SunSmart program going. That's a hat covering up still shaped between 11 and 2 and a high factor 50.
Okay, this is from Jake. I always get bad prickly heat rash when I'm on holidays. I stay covered up most of the time and still get it. Have you any tips? I am using Elav range and SPF 50.
Okay, so Jake suffers from something called polymorphic light eruption, or it's prickly heat for short, and it's a scourge, and it affects people in the Northern Hemisphere again. So when we're used to living in a damp, cold climate, and all of a sudden spring comes, or we get on a plane and we head down to Spain, and the next thing you're covered in an intensely itchy, awful red rash. So everyone's out of the pool and you're inside scratching effectively. So I hear your pain, it's not very nice. if you suffer badly like that from PLE, you can go to your GP and you can be referred to be seen in a phototherapy department in a dermatology department across the country. So what we do is we put you on it's our light machine effectively. So it's a very narrowband form of sunlight that isn't dangerous, but it is a fake form of sunlight. And what we do is we slowly build up the light and we burn off this PLE reaction. So typically somebody with bad PLE will come in around February or March time to us. We will put them on the machine for about 3 to 4 to 6 weeks. We slowly turn up the dial and we basically burn off this polymorphic light eruption, meaning that you can go on holidays and you're not going to have it. So for example, if you went to Spain in March or April, you got polymorphic light eruption. Typically if you went back in June, you're not going to get the rash. So that's the weird thing about polymorphic light eruption. You can actually burn off this reaction. I definitely recommend still using your ELAB factor 50s. That's the best thing to do. If you find yourself on holidays or in Ireland and you get this awful PLE rash, get down to your pharmacy and ask for a topical steroid. Topical steroids are the way we treat polymorphic light eruption. So, or go to your GP for prescription for an ointment-based topical steroid. Ask over the counters out for Ovel's menthol. So Ovel menthol lotion, and you can rub it all over. Keep it in the fridge. Use it from the fridge, and it will cool and calm your skin down as well.
That's great. So we have one here from Monica.
Yes.
I have rosacea and laser treatment helps. However, I get bad lymph swelling under my eyes that leaves discoloration. Any advice?
So this person is getting laser therapy for her rosacea, but gets lymph swelling, I'm assuming post the therapy, under her eyes. I would definitely talk to your therapist. You shouldn't have swelling like that from laser treatment. The laser's too much. So it needs to be stepped back effectively, although it's treating the rosacea, but this swelling with discoloration is a side effect of the laser that shouldn't really be happening. So I'd go and talk to your therapist, whoever's doing the laser. Remember, be so careful about who you go to for laser therapy, whether that's hair removal or pigmentation treatment, rosacea treatment or vein treatment. There's two things. The therapist needs to be good and they need to have a good piece of equipment or a machine. I see, like, you can buy off the high street or Groupon, you can buy laser machines now or IPL machines, and you know, €100 on an IPL or laser machine is not worth it. It's not going to work, or it's going to burn you, one or the other. So the side effects from laser can be hypopigmentation or burning of the skin. And here again, we have so much energy that's going on that it's causing swelling under the eye. So you know what? I think I'd revise your laser treatment. A good tip for rosacea, however, this time of year is you must wear factor 50. UV triggers off rosacea all the time. Keep a diary. Sometimes spicy foods, red wine, citrus fruits can cause rosacea to trigger off. Also talk to your GP. There are prescription treatments topically now for rosacea. One that springs to mind is something called Sulantra, which is really good for rosacea as well. So maybe have a chat with your GP and have a chat with your laser therapist.
Kind of a long one here,
yes.
So I'll make sure I get with this one out. It's kind of related to what you were saying actually just now. Hi, I have a small layer of skin that I've had frozen off my face twice. I can't afford a dermatologist at €150 to do this, but I found a cosmetic or skin clinic who has a cryo pen and will do it for €80. Should I be wary? That's from Kira.
Right. The short answer is yes. I would be wary of that. So I do liquid nitrogen where I work, and I have to have a whole policy around liquid nitrogen because it can cause a bit of pandemonium. Liquid nitrogen is a gas which is minus 190 degrees, and it's so great in dermatology for burning off stuff that we don't want. Start with warts, for example. So it basically burns the tissue and destroys the tissue, which sounds great and it works brilliantly. We sometimes burn off superficial skin cancers with this liquid nitrogen as well. However, the problem is that when you're burning off the bad stuff, you can affect the good stuff as well. So again, you can have vessel damage with cryotherapy. You can have burns. You can get you can have burns from it. You can have swelling. So certainly, I wouldn't recommend that you go now to go back to the start. If it's dead skin cells, you just be sure what you're treating. So you can't blindly treat with cryo. I mean, you could walk into a chemist, for example, and get liquid nitrogen that treats warts. It's effectively the same thing. However, what are we burning off here? I would highly recommend, if you've got your dermatologist and it's just, you know, a seborrheic keratosis, for example, that's benign, that's fine. Now, your GP also has something called histofreeze, and histofreeze is very effective. and your GP is going to be like €50. So if I was you, to be safe and to be in a medical environment, I go to your GP and ask your GP or your practice nurse to do this. An awful lot cheaper and more effective. So the Histo-Freeze would be certainly more effective than the pen, definitely. I haven't seen the pen, and I'm sure it's kind of a form of Histo-Freeze. So if I were you, first of all, the right diagnosis, which you probably have got. Second of all, I'd go to your GP and get the GP or the practitioner to use the Histo-Freeze on you, which would be a better outcome, a better effect.
Okay, I have one here from Eleanor. This is from Eleanor. So she says, I have spots for about 6 to 9 months. I've been using salicylic acid for 6 months and it has not cleared it up at all. I tried also using benzoyl peroxide creams for the last 3 months and that is not having any effect either. What should I do to help clear up my skin? And she has also said I should mention that I don't eat meat or dairy, which I know can cause acne, so she doesn't think that it's diet related.
Right. Yeah. The funny thing about acne is it's rarely diet related, and there's been a lot of research into this to see, has diet got something to do with it? So the typical thing, you're eating Mars bars or you're eating chips and you're going to have greasy skin. You can have a vegan who has terrible acne, and you can have somebody like me that doesn't, not great, has no acne. So actually diet doesn't really have an awful lot to do with it. Acne is caused by sebum on the skin. So sebum is our skin's grease. Sebum keeps our skin ticking over nicely. It keeps it looking moisturised, it keeps it exfoliated. However, when we have the presence of hormone that we do, if we've estrogen, progesterone, testosterone, the hormones increase the production of sebum. And can you imagine our pores in our skin are like little cups? So our pores should be about half full of sebum, and that keeps, again, the wheels nice and greased and keeps things flowing. When you have too much sebum, these pores become filled with grease and bacteria becomes blocked. It can't be shifted up the skin or moved off, and keratin gets trapped as well. So then we get blackheads, whiteheads, we get papules, which are the hard, nasty, red, sore ones, and we get pustules, is the ones that you squeeze, but don't squeeze them. So that's what acne is. There is a method of treating acne that we have in dermatology, and it doesn't involve diet, and it doesn't involve a lot of face washes that you buy over the counter. You need to go to your GP, who can prescribe you something called tetralysyl, which is an oral antibiotic that you take for acne for 6 months at least. So it's a safe antibiotic to take for 6 months, but must be prescribed in combination with something called Triclinic gel. And Triclinic is my favourite at the moment. You've used benzo, and we do use benzo topically, and it works quite well for some people, but when you're really drying actually on the skin. Triclin is clindamycin, which is an antibiotic, and it also has retin in it, which is a form of vitamin A. You use it at night time only, but it doesn't have the drying effect that a lot of the topical treatments normally have. It's really excellent. So it's an oral antibiotic with a topical treatment called Triclin, and you need to be on this for 6 months to see how it works. If this doesn't work, you need to be referred to a hospital-based consultant dermatologist who can, if the antibiotics haven't been successful, who can talk about prescribing something called isotretinoin oroacetate. It's a form of vitamin A, which sounds benign. Actually, it's quite a powerful drug that really helps clear up acne. It works very, very well for people with acne, but can only be prescribed because it has got potential side effects in a hospital environment. So you need to be referred by your GP to a hospital-based consultant dermatologist, but it's definitely worth sticking with the tetralysyl and the Triclin for at least 6 months to see how that works. There's a great article, or there's a great information leaflet on acne on irishskin.ie, and there's also a helpline there for dermatology nurses that you can ring. There is a great leaflet as well on www.bad.co.uk. That's the British Association of Dermatologists, and they have a whole patient information there that's free on acne that explains what I was talking about. So arm yourself with that and get down to your GP.
Okay, last one here for you, Selene, from Pauline. No, I don't know how to pronounce this word, so
Okay.
you have to help me out.
No problem.
She says, I've bad seborrheic, SEBORAH, dermatitis.
Seborrheic dermatitis.
Seborrheic.
Yeah.
Dermatitis on my face, and I've tried everything. And then 3 crying face emojis. Please help.
Seborrheic dermatitis, it's a nuisance, and it's a greasy looking flakiness. It's the dandruff of the face. So when you get dandruff on your hair and it looks like those little white silvery scales, you can get this condition on your face. So seborrheic, meaning it affects the pores, again, those kind of grease producing pores, and dermatitis meaning eczema, so it's kind of red and irritated at the same time. So it's not just straight up eczema, it's a kind of a greasier form of eczema, and it often affects down to the eyebrows and around the nasal labial folds around here, around the mouth. First thing to do, go down to your local pharmacy and get Capsule shampoo. I find Capsule works really well, or Selsun. So Capsule doesn't smell very pretty because it's got a kind of a coal tar base with salicylic acid, and basically there's an overrun of yeast on your face, like the same yeast that kind of causes the dandruff problem on your scalp as well. So when you're in the shower, you work up your Capsule shampoo. Leave it on for 5 minutes in contact with your scalp. That can be really difficult to do because often if you've got seborrheic dermatitis, you've got a bit of flakiness in your scalp as well. Leave it for 5 minutes. Then let the suds rinse down your face, and you'll find that will help with the yeast overrun on your face as well. Repeat the process too. So do 2 shampoos with that. Don't use any of like the normal shampoos and conditioners. Use the Elav conditioner if you need to condition your hair thereafter, because it won't encourage this overproduction of the yeast too. We often use something called Dactacort on the face as well, in those areas where you have the problem with the seborrheic dermatitis, and that'll help clear it up. Change all your products over to Elav products as well, because that won't encourage, again, the yeast production. Another one you can try is there's a product by Bioderma called Sensibio. It's Sensibio AR, I think. But if you go into anywhere that supplies Bioderma, and I know Care Plus Pharmacy have Bioderma products, if you go into the pharmacies there and ask for the seborrheic dermatitis wash and moisturiser, they have a really great moisturiser that can help seborrheic dermatitis. But you can't ever go back to using normal shampoo. When I say normal, the stuff that smells beautiful that you pick up in Tesco or Dunn's. Use Capsule or Selsun. Use Elav or conditioner if you need to, just on the ends of the hair, and don't use anything else, or otherwise you're going to have a recurrence of this. Get yourself some Dactacort and apply sparingly twice a day until the condition comes under control, then reducing down to once a day. And again, use your Elav moisturising products, or try the Bioderma. I'm sure it's called Sensibio, but if you go into the Bioderma stockists, they will point you in the direction of the correct one. Again, there's a great leaflet on seborrheic dermatitis on www.bad.co.uk, and just go under patient information leaflets and look for seborrheic dermatitis. Also, if anyone has another skin condition that they have queries on, you can always log on to irishskin.ie, and there's a nurse helpline there. There's a free phone. I think it might be low colour free phone, something like that anyway. And you can leave your question, and a dermatology nurse specialist will get back to you with your answer. They were great questions again.
Yeah, this is a big thank you in from Eleanor and also from Jake for your help.
You're welcome.
And that's us for this week.
Great, thank you.